With me now is Dr. Christopher Labos, epidemiologist and cardiologist. Merry Christmas, Doctor.
Oh, Merry Christmas to you too.
Thank you. Now, it's been recorded as the worst flu season in years. How significant is that? And why is it that this season is so bad as compared to the others in the past?
Well, there's a few factors that are playing into it. One, influenza essentially disappeared during the pandemic because of the lockdown measures. So for 2020, 2021, and even into 2022, we had much lower influenza levels than normal. But even looking back, I think you can look at the current flu season and realize, number one, it has clearly started earlier than it normally does. Usually influenza really gets underway January, February, which is when it peaks. So it has peaked much earlier. Also, the particular strain of the flu that is circulating right now, H3N2, does actually appear to be more infectious and more virulent, infecting more people and causing more severe disease. So there's sort of a confluence of factors that are at play here.
Talking about infecting more people, which age group is seeing the most positive results here, Doctor? Because data is also suggesting that it's the young that are getting more infected this time around.
Yeah, and I think that's true. You have to be a little bit careful with influenza, though, because most people don't actually go and get tested, right? Because the only way that we can diagnose you with influenza is with a nasal swab, but that's only going to happen if you go to the emergency room. So, you know, the people between the ages of like 18 and 55, they probably are getting infected, but they're not going out and getting tested. So it will make it seem as if it's the extreme of age that are getting most of the infections, but it's just that they're the ones who are ending up in hospital and getting tested. So there's a bit of a selection bias going on in there, but you know, it does look as if flu is being recorded in high levels sort of across the board.
Let's talk about precautions, because this is, of course, a busy time in terms of social gatherings, as we know. So what precautions should one be taking?
Well, most important one is if you're sick, stay home. You know, going to a place with other people and getting them sick is not a very good Christmas present. So if you are sick, stay home. Number two is get your flu shot. It is not too late to get your flu shot. There is probably still many weeks of influenza ahead of us. So anything that you can do to minimize your risk makes a big difference. And the big thing for gatherings, whether they are holiday gatherings or not, is clean the air. So if you can get an air filter for your home, or if you have a central air system with a built-in filter into your HVAC system, that's going to make a difference, because if you can circulate and clean the air, that will help. So there's a lot that you can do on the micro level, but there's also a lot that you can do on the macro level, which is cleaning the air. So that benefits everybody that happens to be in your home or holiday party.
Also just curious, Doctor, about the vaccination rate this time around when it comes to the flu vaccine. What are we seeing?
It's not as high as we would like it to be. This is a perennial struggle with influenza. It's very hard to motivate people to go out and get vaccinated. A lot of people still think that they're not eligible, whereas they are. Where I am in Quebec, a lot of people still think you have to pay for the influenza vaccine, which was true up until 2020. That policy changed a few years ago, and a lot of people haven't realized that it has changed. So I think it's not as high as we would like it to be, and it is... The big issue that we have in the modern era is there's a lot of, maybe not vaccine hesitancy, but a lot of vaccine fatigue, where people thinking this is not all that necessary. But we forget that influenza kills thousands of people every year. And if vaccine uptake is high, that tends to blunt the impact influenza has on ourselves and on the healthcare system.
All right, we leave it at that for today then. Dr. Christopher Labos, epidemiologist and cardiologist, appreciate your time and insights. Thank you, Doctor. Have a good day ahead.
Thank you. Take care.